When we look at the three subtypes of breast cancer, when we consider hormone positive, HER2 low, or excuse me, HER2 and triple negative, are we adding a fourth category by having HER2 low? Is this a new category of breast cancer?
So this is an important question, and the answer is no, but kind of no, meaning that those three subtypes, so triple negative, hormone receptor positive, HER2 negative, and HER2 positive, remain key in order to treat the patients, remain key to determine the algorithms to treat the patient. And so if a tumor is HER2 positive, you'd use the algorithm for the treatment of HER2 positive. If the tumor is triple negative, you have completely different algorithms and behavior of the disease. And so these three categories remain unchanged, but you have an additional layer, let's say, to stratify. And so I feel that one slide that can help is this one. So you still have triple negative and hormone receptor positive, but among these two subtypes, some part of the triple negatives and some part of the hormone receptor positive are also HER2 low. So it's an attribute that you can add to the basic subtype. And I know it's very complicated and intricate, but I think that this is just something that adds a treatment opportunity. So if you have a triple negative tumor, you use some drugs that have been shown to be beneficial in triple negative, like chemotherapy and sometimes immunotherapy, like another antibody drug conjugate that is called sacituzumab govitecan. But if you can also detect some HER2 low expression that is found in about 40% of the triple negatives, you know that you can use also TDXD. The same for hormone receptor positive. If you have an hormone receptor positive tumor that we know that can benefit from endocrine treatment for CDK4/6 inhibitors like palbociclib, ribociclib, or other drugs, and you also find HER2 low expression in this tumor, and so this happens about 60% of the hormone receptor positive. In those cases, you can also use TDXD. So HER2 low is not a new subtype different from triple negative or hormone receptor positive. You can be both hormone receptor positive HER2 low or also triple negative and HER2 low. And so the basic subtype is triple negative or hormone receptor positive, HER2 positive, but then you can further stratify toward HER2 low or HER2 zero.